Good evening, guys. I have one bonus show for you. Um, it's about elderly people and long-term use of benzodiazepines, which are pain pills for those who aren't familiar. Okay, so I'm going to go through the presentation I made for you. Please sit back and enjoy. Okay, here's a summary of the key findings from the article titled Study Finds Decline in Long-Term Benzodiazepine Use among older adults, but risks remain. Okay, so we're going to go through that tonight for E. So please join me. Okay, main takeaways. Decline in long-term use. More older adults are discontinuing benzodiazepines shortly after hospital discharge, which is a positive trend. Persistent risk. Despite the decline, a significant number continue using these medications for months, increasing their risk of serious health issues. Health concerns. Long-term benzodiazepine use is linked to falls, cognitive impairment. Just a minute, guys. I'll give you the full list in a second here. Dependency, motor vehicle accidents. Okay, study scope. Researchers analyzed data from over 33,000 patients age 65 plus who were prescribed benzodiazepines between 2004 and 2025. Common medications, drugs like lorazepam and clorazepam were among those prescribed. Updated guidelines. Experts, including the American Society of Addiction Medicine, have issued a new tapering guidelines to help reduce dependence and adverse outcomes. If you're curious about how this might affect prescribing practices or patient care, I can dig deeper into that too. Just 1 second, guys. The study's findings are already influencing prescribing practices in several important ways. Shifts in prescribing behavior. More cautious initiation. Physicians are increasingly reluctant to start older adults on benzodiazepines unless absolutely necessary due to heightened awareness of long-term risks. Shorter duration prescriptions. When benzodiazepines are prescribed, they're more often limited to short-term use, typically just enough to manage acute symptoms post hospitalization, increased monitoring. Doctors are more likely to follow up with patients to assess the need for continued use, and watch for signs of dependency adverse effects. Emphasis on deprescribing, tapering protocols, new guidelines from organizations like the American Society of Addiction Medicine encourages gradual dose reduction to safely discontinue use. Alternative therapies. There's a stronger push toward non-pharmacological treatments for anxiety and insomnia, such as cognitive behavior therapy and mindfulness-based approaches. Patient education, risk communication. Providers are more proactive in discussing the risk of long-term benzodiazepine use with patients and caregivers. Shared decision making. Prescribing decisions are increasingly collaborative, factoring in patient preferences and long-term health goals. If you're curious how this might play out in real-world clinical settings or policy changes, I'd be happy to explore that next. Health policies are evolving in response to the study's findings on benzodiazepine use among older adults, with clear shift toward safer prescribing and discontinuation practices. Policy changes in motion, updated clinical guidelines. Organizations like American Society of Addiction Medicine have released new tapering protocols to help clinicians safely reduce benzodiazepine use after hospitalization. Hospital discharge planning. Hospitals are revising discharge protocols, procedures to include medication reviews that flag benzodiazepines for reassessment, especially in older patients. Insurance and reimbursement adjustments. Some insurers are beginning to support coverage for non-drug therapies, e.g., cognitive behavioral therapy, as alternatives to long-term benzodiazepine use. Prescriber education initiatives. Health systems are rolling out training programs to educate providers on risk of prolonged benzodiazepine use and the importance of deprescribing. Okay. Focus on geriatric safety. Fall prevention programs. Since the benzodiazepines are linked to increased fall risk, some public health agencies are integrating medication reviews into fall prevention strategies, monitoring, and reporting. There's growing interest in tracking benzodiazepine prescribing trends through electronic health records and state level prescription monitoring programs. These shifts reflect a broader movement toward minimizing medication related harm in older adults. If you'd like, I can show how these changes compare across different states or countries. Great question, especially in light of the recent study on older adults and benzodiazepine use. Here are the current best practices for prescribers. Prescribing benzodiazepines responsibly. Start low, go slow. Use the lowest effective dose for the shortest duration possible. Avoid long-acting benzodiazepines in older adults due to prolonged sedation and increased fall risk. Assess risk versus benefits. Evaluate the patient's history of falls, cognitive impairment, substance use, and polypharmacy. Consider non-drug alternatives. First, especially for anxiety and insomnia. Educate patients. Clearly explain the risks of dependence, cognitive decline, and motor impairment. Discuss the plan for tapering before initiating therapy. Limit duration. Avoid prescribing beyond 2 to 4 weeks unless absolutely necessary. Reassess frequently and document the rotation for continued use. Use tapering guidelines. Follow updated tapering protocols from organizations like the American Society of Addiction Medicine to safely discontinue use. Gradual dose reduction is key. Abrupt accession can lead to withdrawal symptoms. Coordinate care. Involve pharmacists, mental health professionals, and caregivers in the prescribing process. Ensure community continuity of care during transitions, e.g., hospital discharge. These practices are especially critical for older adults who are more vulnerable to the adverse effects of benzodiazepines. If you'd like, I can walk you through a sample tapering schedule or explore alternatives like CBT or melatonin. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.